Nancy Lane, and I'm going to be the nurse taking care of you in the OR today. I was nervous, but I feel a lot better.
I always wanted to be a nurse when I was a little girl. I wanted to be a nurse, and when I went into high school, after that, when I graduated, I went right into nursing school.
So I was about 7 years old, and it's never wavered. I wanted to be a nurse since then.
I was born in a pair of Army boots. My mom and dad were both Army nurses, and I also served in the active duty forces for 11 years.
It's always been in the back of my mind throughout my life, and I graduated May 2011.
And I actually took biology for 2 years in college, but in Maine at the time, if you wanted to work in biology, the only place you could work was at the local fish hatchery.
I'm nearing the end of my program. I'll be done in May, so I'm a senior.
Just be working and go home and not have homework to do will be wonderful.
I thought it would be a great way to earn some money so that I could go on and become a veterinarian.
And I looked through the course catalog of the community college, and I saw nursing. I read the description and I thought I could do that.
It's harder than my original degree, which was in fine art.
It's really sad because I have lots of friends that I talk to, and they get out of school, they have all this huge student loans that they can't pay, and they're doing a job they don't enjoy.
I decided to go into nursing when I was in 4th grade. I've known since I was little that I wanted to be a nurse.
It's in the statistics that if new nurses don't get the help that they need within a year or two, then they either just move out of the area that they're caring for patients in, or they leave nursing altogether. It's a very hard job, and they need support.
Patient arriving at Practicum.
The 3.1 million nurses in the U.S. represent one of the largest segments of the country's workforce, and they are the largest segment in the healthcare field. Meanwhile, the mission of Maine Partners in Nursing is to elevate nurses through the improvements and connections in education and practice, while preparing for the growth in Maine's elderly population. Maine Partners in Nursing Education and Practice is a grassroots organization. Its members include state and private colleges that represent nursing programs across Maine and the sites where nurses practice: hospitals, nursing homes, home care, and mental health facilities. It also has members from the community, the state legislature, and the State Board of Nursing. In 2010, the group received a grant from the Nurse of the Future initiative, led by the Robert Wood Johnson Foundation and the Northwest Health Foundation. Here in Maine, matching funds were raised from the Bingham Program, the Betterment Fund, Omni Nursing Leaders of Maine, and private donors. Out of these alliances came the funding to support 10 innovative projects to reimagine nursing in Maine.
Yes, very good. Feedback.
In this film, you will meet some of the students, licensed nurses, teachers, and nurse administrators involved in our projects. You will meet some of the patients who are at the receiving end of extraordinary care. We must also emphasize one of the missions we are most proud of. Maine Partners in Nursing Education and Practice cares for the caregivers who may likely care for you someday.
How are you feeling?
Maine is getting older. In fact, it has one of the highest median ages of any state in the country. According to the State Planning Office, our proportion of elderly residents will double in less than 20 years. The clear challenge, then, is to attract nurses to geriatric care and support them once they make that move.
The state of Maine is aging faster than any other state, and we, in the next decade, will be looking at a whole different model of health care.
I think Maine is very well positioned to be leaders in gerontology nursing, particularly in the community side of nursing, looking at ways that we can better help older adults age well in their homes and in their communities.
Even going through nursing school, people would ask me, what field do you want to work in? And I would say, I kind of like geriatrics. And they'd be like, geriatrics. Well, it's been really positive.
I like long-term care. you're there day after day and you can really make that bond. Like when I go and visit them, I want to be there. I want to hear their stories. I want to hear what their life was about. That kind of information, like it's a conversation.
I had training, I was a Navy medic. So for instance, when they're drawing blood or giving a shot, I kind of give them a hard time and say, well, I'm going to give you a grade on it.
If you're going to be an effective geriatric caregiver, you have to listen to the whole person. We almost become a part of their family and they a part of ours.
No, I think I feel very secure. I think they treat everybody as a resident of the inn, not a sick person.
You're not just a cog in a wheel.
And that's important to you?
Oh, yes.
What?
Well, I think that's why I'm feel as good as I do today.
When we're all together, it feels like, okay, this is just the stage that I'm at as a new nurse, and I'm not alone. There's other people going through it.
It brought all the new grads together, and we worked together a lot and helped each other. It was a great experience, and it was a great help.
I love the residents and the just the whole feeling of it, being a member of the nursing staff, but also feeling like a part of a family in a way, that you're caring for these people and this is where they live.
It's more than just a job with them. They're part of this community to make it a good community for us.
It is widely recognized that many students feel unprepared for the real-life demands of the work world. Statistics also show a high rate of turnover in the ranks of new graduate nurses. A recent study showed nurses switching to less demanding positions, moving to part-time, or seeking a new place of employment. In response, 6 of the Nursing Partners initiatives address these issues.
No.
No, not necessarily.
Not true at all.
It's stressful. It's very stressful.
It's pretty tough. It's a lot of work. Put a lot of study hours in every day, so.
It's not easy, and I have pushed my way through, and I'm making it, and I will be a nurse in May.
We have clinical instructors that are in class with us, so it's nice that they can hear what we're doing in class and reinforce in clinical what we're doing.
Already you can tell after a couple weeks that we've had a lot more hands-on experience.
I was very nervous because it's a lot of responsibility to take on. I went from having just 3 patients in nursing school to 15 all to myself.
It's complex in healthcare and things come at them from all angles.
No matter how prepared you are from clinicals, no matter how much you've seen in your clinicals, you're never going to feel 100% ready to fly on your own.
I really enjoy working with new graduate nurses because they are afraid when they first come in because you don't know what you don't know, and I tell them that openly. None of us know what we don't know, so it's okay to ask and it's okay to be at that place. It's been just an eye-opener when you watch them go from, I'll say, week to week, and they've worked with their mentors and they're learning more, and you can just stand back and watch how they just take over and are feeling more comfortable with themselves and more confident. Their body posture changes and they're smiling more, so it's just really very encouraging to see that happen. I love it.
I graduated in 1980, and they talked about reality shock in school, but you never really knew what it was until you went through it. So 30 days out of school, I was in charge of a 35-bed ward, med-surg ward. I had 1 LPN and 2 aides. I remember going home a few nights and crying, right? So not understanding and just feeling the frustration.
The average OR nurse is aging now, and we do not have a lot of younger nurses that are in the field.
Well, this specific practicum has helped me really see the patient from pre-admission testing to ACU to the OR to PACU. I see the patient go through each department. I do feel anxiety a little bit. I won't have my teachers or my preceptor right there, right behind me, but I am excited to be on my own and I feel ready.
I think with this, with the newer leadership at Acadia, I think they're really recognizing the need to empower nurses to be leaders on the units and to provide them with the tools so they can become effective leaders.
They can't wait to go through it. They're saying, geez, finally something that's coming along that's going to be positive and help us out. A lot of good feedback with it, and a lot of people are excited about it.
Visiting nurses and home health care are tremendously cost-effective. In fact, care in the home by a visiting nurse costs just a fraction of what hospitalization incurs. Looking ahead, the demand for home health care will more than double in the next 10 years. Visiting nurses, then, will be even more essential and cost-effective. Meanwhile, more patients will benefit with easier access to nursing care when they need it, right in their home.
Having a visiting nurse come to your house is a lot more relaxing. It's more of a quieter setting where you go to a doctor's office, you're always a little bit hyper, but in your own home you're more relaxed and you can sit there. And I never found that the visiting nurses were ever in a rush. They weren't looking at the watch and say, I got to get out of here. They were all, were always more than willing to take the time and answer any questions, and if I needed any help.
I've been a visiting nurse for about 7 years total. I like being a visiting nurse because it puts me on the patient's turf rather than them being on my turf, and I actually prefer that.
They were outstanding to me, and I would recommend to anybody that they should take full advantage of the visiting nurse.
You can see then that Maine is innovating in 3 important areas to get us where the nurse of the future needs to be. Strengthening the connection between education and practice, helping graduate nurses in their new jobs, preparing for increased needs in geriatric and home health care. At the same time, Maine Partners in Nursing Education and Practice is proud to support the nurses and educators who will continue to lead the way forward as they reimagine the future of nursing in Maine.
With fine art, it was all about me and what I could create and give to the world, but with nursing, it's all about the patients and learning how I can help them and help them be better and healthier and stronger.
Because I want to help people and I want to be someone's rock in their time of need when they're ill, and I look up to nurses and I want to be a nurse.